Nowadays, there are a lot of available application games on smartphones, such as PUBG Mobile, the most in-demand and popular games of all time. The Candy Crush, the legendary puzzle game that no one can resist. But do you know that playing continuously on mobile games might increase the risk of trigger finger? We cannot deny that the smartphone seems to be one of our essential organs. The more application or games we have installed on the phone, the harder we can stay away from it, and the risk of trigger finger will be increasing as well. Besides using a smartphone, there are other risky behaviors that can also increase the risk of trigger finger, such as carrying heavy things, housework, gardening, or even ball squeeze exercise that a lot of people think that it could help strengthen hand muscles. But this will increase the risk of trigger finger instead. Trigger finger is a condition that affects one or more of the hand's tendons, making it difficult to bend the affected finger or thumb. It usually affects the thumb, ring finger, or the little finger. One or more fingers can be affected, and the problem may develop in both hands.
So the trigger finger we can categorize in the four states. The first stage is present with the inflammation of the tendon or its pulley itself. Okay, so patient will present with painful or soreness or discomfort at the base of the finger. But in this state, maybe not the catching or triggering yet. Stage 2, when the its pulley and the tendon is disproportionate, patient will come to present with not smooth when they make a fist or extend the finger. Like they feel like not smooth like before and maybe painful. Stage 3, it means that its pulley is maybe thicker than stage 2. When they make a fist, it cannot release by themselves. They have to use another hand to release it. And if go to the last stage, stage 4, the finger joint is come stiffness. And in this state, it cannot even make a fist or even make it full straight of the finger.
Traditional treatment for trigger finger is an open surgery. An incision will be made in the palm and the affected tendon sheath will be cut off. The operation will take around 1 hour. Currently, there is an innovative treatment for trigger finger, which is called the ultrasound-guided percutaneous trigger finger release. This treatment can be done in approximately 5 minutes. As percutaneous trigger finger release does not involve making an incision, the patient will not have a wound or a scar.
Before we perform this procedure, we have to scan with the ultrasound machine first to see which part of the pulley that thick or that cause of the triggering the finger. After we find that, we start with inject the anesthetic agent. It takes less than 1 minute. After that, we start to use the special needle to release or cut the thickness pulley. After that, we will check again after finish the procedure that everything is fine, no any unreleased thick pulley. And we will finish the procedure.
Trigger finger is a condition that can be prevented by resting your hands, avoiding repetitive grasping or gripping motions. If there is inflammation, we recommend to take anti-inflammatory medication or soak your hand in a warm water. Or you better go to see a doctor in order to receive proper treatment.